Hi, I'm Dr. Matthews. I'm here today to talk to you about muscular fitness and flexibility fitness, and this is specifically geared towards health. All right, so a couple textbooks and chapters to highlight here: the American College of Sports Medicine, or the ACSM's resources for the exercise physiologist, the second edition, chapters 4 and 5. If you want to see the book I'm talking about, you can scan this QR code here. And the ACSM's guidelines for the exercise testing and prescription, 10th edition, chapter 6. And again, you can scan this QR code here to see which textbook I'm talking about. So I'm going to highly recommend that you read those textbooks in conjunction with watching this video. And also there's going to be some times where I'm going to refer to tables and figures in those textbooks. So you're going to have to open to those, the figures and tables I'm talking about in the textbooks, because I won't have those in the PowerPoint itself. A little extra disclaimer here. This course is not designed to be a comprehensive course in muscular fitness, and it's not geared towards sports performance or even fitness so much. It's more of a health-oriented course. So we're not going to have a lot of emphasis on this topic, on the muscular fitness and flexibility side of things, and you're probably going to want to go to another source in order to get more information, especially if you're going towards strength, endurance, muscular power, those sorts of things, because we're really not going to talk about those in any length of any sort of detail in this lecture here. Looking at the sequences for exercise prescription tests, we are looking at numbers 8, 9, and somewhat 11 here. So we're testing muscular strength and muscular endurance. We're looking at tests of flexibility, and we'll look a little bit at the exercise prescription for muscular fitness and flexibility. A couple basic terms here, as well as some concepts. An agonist muscle is a muscle that is the primary mover of a joint. So if I take my elbow here and I flex it in on itself, the primary mover for that is the biceps muscle. So that is the agonist. You also have synergist muscles, which are the accessory muscles that also connect to that same joint and help with the movement, but they're not the primary mover. And then on the other side of things, you have an antagonist. And an antagonist muscle is one that opposes the movement. So using that same elbow flexion example, the antagonist would be the triceps on the other side of the arm. They resist the movement towards a flexed elbow. So the only muscles that are going to actually adapt to the exercise you're doing are the ones that are actually being stressed during that exercise. So if I'm doing a lot of, say, bicep curls, I'm not going to get anything for my legs. My legs are not going to adapt. The muscles aren't going to grow, strengthen, do whatever. All right, so you have to perform resistance exercise for each muscle group that you want to get stronger. Again, so there's no carryover to muscles that aren't involved in the exercise. Another concept here is that different training loads, so in other words, the resistance, how much resistance, is it a heavy weight, is it a light weight, different training loads is going to stimulate different muscle fibers. All right, so greater training loads are more likely to activate more muscle fibers, and lesser training loads are more likely to activate less muscle fibers. And also there's some type 1, type 2 muscle fiber differences between the stimulus that you're giving the muscle and which type of muscle fibers are going to activate. The ACSM tends to really stress aerobic fitness for health. They don't talk as much about muscular fitness since this is very much an ACSM-based course. That's why we're not talking much about it either, but it is important to note that muscular fitness is something that is good for your health, and it has a whole bunch of positive side effects or positive effects on your health, including things like decreased all-cause mortality. So in other words, you're less likely to die, fewer cardiovascular disease events, so fewer heart attacks, fewer strokes. Probably the most important one that's on this list, though, all these are important, but probably the one that we most associate with strength training activity is increased bone density. All right, so bone health is greatly improved by muscular fitness tasks, so essentially resistance training, and it's not quite as improved when it comes to aerobic training. You got to have some high strain load in order for bones to become more dense, and so resistance training is great for this. Aerobic training is not so great typically for this. There's a lot of overlap between the benefits of muscular fitness and aerobic fitness. However, aerobic fitness is generally a little bit better at things related to the cardiovascular system. Muscular fitness is usually a little bit better at obviously working in improving muscle health as well as bone health. When talking about muscular fitness, we're going to primarily focus on muscular strength and muscular endurance. Again, we're not going to talk about muscular power. We're not going to talk a lot about hypertrophy here. Muscular strength, though, is the maximum amount of force that a muscle can produce. Probably the best test for this would be a 1 repetition maximum. Muscular endurance is how much force you can produce in a sustained fashion. So either repetitive contractions several times, so 15, 20, 30 times, or holding a single contraction for a very long time, think like a wall sit or a plank or something like that. So muscular fitness can be tested using push-up tests, curl-up tests, basically anything where you're capable of doing at least sort of 15 to 20 repetitions or more. If you're not doing at least 15 repetitions, it's probably not a test of muscular endurance. The goals for testing muscular fitness are very similar to the goals of testing aerobic fitness. Things like determining the weaknesses, so specifically here, we're determining the weaknesses of which muscle group. So are your arms strong enough for a typical person of your type, so age and sex matched, while your legs maybe are weaker than somebody your same age and sex. All right, so that's identifying weaknesses around muscle groups, identifying weaknesses of specific muscular components of fitness. So in other words, are you very weak? In other words, you don't have a lot of strength, but maybe you have a lot of endurance. So that means maybe you need to work on the strength, but your endurance doesn't need quite as much work. Or vice versa. Maybe you're super strong, but you can't really do a lot of muscular endurance type activities. You can't lift the same weight several times or for a long period without getting exhausted. So that would mean you have to work on muscular endurance. Another goal here is to establish a starting point for the training. So in other words, you're going to have a baseline and then maybe 6 months later retest and have a post exercise intervention test, so you can compare between the 6 months and the baseline and see, did the workout plan that was created for your client, did it do its job? When testing muscular strength, the best test we have is the 1 repetition maximum, or the 1 RM. I already mentioned this briefly, but it is the greatest amount of weight that can be lifted a single time, so in other words, a single repetition. And it is the gold standard for muscular strength testing. So just to talk really quickly about the process here, always do some sort of warm-up. Typically you want to do a little bit of aerobic exercise before doing any testing like this, just to get the muscles warm, get a little sweat going, raise the heart rate a little bit, get blood flow to the muscles. And then you want to do a warm-up set, so you do whatever the test that you're going to do. So let's say you're going to do bench press, so you do a very light set of bench press just to kind of move through the range of motion, make sure that the muscle is completely loose and is capable of going through that full range of motion safely. And then you're going to try in 3 to 5 attempts to get your 1 repetition maximum. So basically, you put a certain weight on the barbell or whatever equipment you're using, and you try to do a single repetition. If you're capable of doing it, then you go up to the next weight and you try it again. If you're not capable of doing the weight that you chose initially, you go down a level of weight and then you try again. And all it is trial and error. If you're capable of doing it, you go up. If you're not capable of doing it, you go down until you find that one point in time where you can lift the weight here, but you can't lift the weight just above it. So that would be your 1 repetition maximum. A lot of people are kind of scared of the 1 repetition maximum because it's a very high stress activity to perform. I just want to highlight here, though, it is safe for most adults. So you can make pretty much any exercise into a 1 RM test. However, it's probably best to do 1 RM testing on multi-joint exercises, so things like the squat, bench press, the overhead press, the row, the lat row, or the lat pull down. Those are all multiple joint exercises where there's at least 2 or more joints involved in the movement of the weights. If you're doing 1 RM testing on a single joint exercise, so something like a bicep curl, it provides a lot of stress onto that joint, and because it's the only joint involved, all the stress is on a single point, and it just increases the likelihood of an injury. most likely the client's going to be fine, but there are other tests that can be done other than a 1RM test that would be safer, that would probably be a more optimal choice. And remember, anytime that you're working with free weights and the weight's going above the body, whether that's above the chest, above the head, whatever, you probably should be using some sort of spotter. And there are some exceptions to this, but generally speaking, free weights do require spotting. So in other words, somebody who's going to prevent the weight from landing improperly and hurting the individual who's lifting. All right, so don't assume somebody can do the weight on their own. Make sure that you are there spotting your client. So as mentioned, there are times specifically doing single joint exercises where a 1RM probably isn't your best choice. So one thing that you can do that is very easy and gets you to an estimated 1RM is to do a multiple RM test and then calculate what the 1RM would have been. So here's an example of a formula that is capable of estimating 1RM. It does a really nice job. So basically you take a weight, whatever that weight is, it has to be something that you think the person can do somewhere between 1 and 10 repetitions. So you don't want them not being able to do a repetition, and you also don't want them being able to do more than 10 repetitions, because that starts getting closer to muscular endurance rather than strength. But anyways, you pick a weight. Let's say they're doing the bicep curl. Again, it's a single joint exercise. Probably shouldn't be done with a 1RM test, but 1RM estimation is perfectly fine. So maybe you think that the person can probably do 3 or 4 repetitions with a 40-pound dumbbell. So you put 40 pounds into this, you have them into this spot in the equation, you have them do as many repetitions as they can. Maybe they surprise you and they get to, say, 6 repetitions, and you put however many repetitions they did here, so you put that 6 here, and then you just do the math, and it's going to give you an estimated 1RM for that lift for that individual. So it is a really nice calculation that gives you something to work with when doing exercise prescription for muscular fitness, because typically things are going to be prescribed as a percentage of the 1RM. So it's nice to be able to get a estimated 1RM when a true 1RM is probably not the best decision. If you're working with somebody who's severely deconditioned, or somebody who is a complete novice to strength training, and you don't anticipate that they're going to be able to properly do a bench press or whatever other exercise you can come up with, it is acceptable to do a single test of muscular strength, and then to use that to just get a sort of index of their full body strength. And if you're doing that, probably the most common test would be the hand grip test. So you just have the person squeeze a hand grip dynamometer as hard as they can, and you figure out how strong their hand is, and from that you get an idea of how strong they are as a person. Now, of course, there's some assumptions being made there. You're testing the hand, you're not testing the leg or the shoulders or the chest or the back or anything like that, and so you're assuming that the strength of the hand is the same, or it's similar in as far as the percentile rank of the individual as it would be if you were testing those other muscle groups. And that's a big assumption, but for somebody who's sedentary, who doesn't exercise a lot, it's probably a pretty reasonable assumption. Even people who do exercise, it's a somewhat good assumption to determine how much strength they have. If you want to learn how to do hand grip testing, box 4.6 in the guidelines textbook from the ACSM, so you can scan this QR code here. It's going to show you how to do hand grip testing. Also, if you want to scan this QR code over here, it'll show you a video showing how to use a hand grip dynamometer, which is what you're going to need in order to do hand grip testing. So that was muscular strength. Now let's talk about muscular endurance. So muscular endurance, again, is how many times you can do a single lift repetitively. So again, can you do it 15 times? Can you do it 30 times? The person who does it 30 times has a greater muscular endurance than the person who did it 15 times. Or the other way of doing this would be how long you can hold a contraction for. So maybe doing a wall sit, can you do for 20 seconds, where somebody with greater muscular endurance can do for 45 seconds. All right, so both of those would be tests of muscular endurance. So a very common test, though, for muscular endurance is the push-up test. All right, so with this, it is how many push-ups you can do without stopping or without losing your form. So if you pause at the bottom, the top, anywhere throughout the movement, that is the end of the test. And I will just note here that for males, so for men, the standards, the norm standards, are all based on the standard toe position for push-ups. In other words, their toe is the axis point for the body. And for women, the standards, so the normative charts, are all based on the modified push-up, which puts the knee as the axis point for the body. So even though you might be working with a female who can do a standard push-up, or a male who can't do a standard push-up and needs to do a modified push-up, you're not going to have normative charts for those individuals if you choose to do the push-up style that doesn't match their sex. So I recommend trying to do the push-up style that matches the normative charts for their sex. But if, say, it is a man who cannot do the standard push-up, then you probably just want to choose a test other than a push-up to test their muscular endurance. I already mentioned this, but if you're not able to do at least 15 repetitions of whatever the exercise is that you're using as the test of muscular endurance, then it is not an adequate test for muscular endurance for that individual. Alright, so if you have somebody doing the push-up test and they can only do 12 push-ups, then that means they are not, they don't have a great enough muscular strength, muscular endurance in order to use that test adequately. So they need to be using some other test, maybe a curl-up test or something like that, in order to test their muscular endurance. Another very common test of muscular endurance is the YMCA bench press test. So this is a test where you set up a barbell with either 80 pounds for men or 35 pounds for women, and you see how many times they can do a bench press with that barbell to the speed or the rate of 30 lifts per minute. So you need a metronome in order to do this properly. All right, so in other words, if you go off pace or if you fail to do the repetition, that's the end of the test. And that's how many, at that point in time, is how many repetitions they were able to do for that test. Remember, anytime that the person is doing free weights, there probably is a need for a spotter, with some exceptions, but generally speaking, a spotter or somebody very close by watching them should be there during all fitness tests, especially those with free weights. Just like almost any exercise can be turned into a test of muscular strength just by doing a 1RM or an estimated 1RM, just about any exercise can be turned into a test of muscular endurance as well, just by using a light enough weight where they can do at least 15 repetitions, and then you just test how many repetitions they can complete. Now, keep in mind though, if you're using a test that is not very commonly performed, you might not be able to find normative values for that test, specifically for your client's sex and age, and so it's going to be hard to compare them to anything. Now, you can always compare them to themselves, so you can do pre-testing and then post-testing, after they've exercised under your guidance for a period of time, and then just use themselves as the reference. But at the baseline period, you're not going to have any reference to compare them to. This slide here has a series of terms that are very commonly used when talking about resistance training and how to do resistance training properly. So we have overload here, which basically means doing a strain to the body that the body is capable of doing, but that it's not used to doing. All right, so if somebody lifts weights all the time, but they very rarely, let's say doing the bench press, they very rarely go above 135 pounds, and you have them do 150 pounds on the bench press, that's an overload. They were probably capable of doing it. They were able to do the lift. They were able to complete the repetitions you asked them to complete. However, it was above and beyond what they're used to doing, and so their body was strained by doing it. All right. So again, overload's a good thing. You need overload in order to adapt the body and to cause a training stimulus. But overload does not mean doing too much. It means doing more than what is normal for that individual, not too much. So it's not a bad thing. Progressive overload is a similar concept. So when you overload somebody, you're providing a training stimulus so that hopefully their body will adapt and become stronger, become more endurance, will have greater endurance, whatever it is you're trying to train. So it's going to improve hopefully. And as that individual improves, you need to progress the overload. So in other words, make the overload greater in order to make sure that there's continually an overload stimulus that's going to cause them to have training adaptations. So this is, right now they can only do 135 pounds, and over time they're capable of doing 150. So you need to progress them to 150 pounds in order to continue having them getting better. Right, so maybe after a while you go to 150, and then after you are at 150 for a little while, maybe you go to 160, and that is progression. Okay, so progressive overload. Specificity. So specificity is a term that you're going to use all the time when talking about fitness. It's super important for basically every aspect of exercise prescription. Specifically, what we're talking about here with specificity means however you train them, that's how they're going to get better. Okay, so they're not going to get better at things you don't work with them on. And so if somebody is trying to train for a specific purpose, maybe they want to run a 5K road race, or maybe they want to get a stronger lower body, then you need to train them specifically using those muscles, those muscular systems, the speed of movement that they are going to need for the activity they're trying to get better at, and so on and so forth. So if you don't train them as close to their intended performance as possible, then the training wasn't very specific to their goals, and so you're violating the specificity principle, and they're not going to get that much better. There'll be a little bit of carryover probably, but you could have made them much, much better by giving them a more specific training program. Reversibility here. So reversibility is just detraining. So in other words, if you train somebody and they improve and they get a lot better at whatever it is, and then you stop training them, they're going to then go down, and they're going to decrease their fitness over time. And so all training is reversible, so you can get better and you can get worse if you stop using it. So it's kind of the use it or lose it principle here. Regularity is the idea that the person needs to do the training stimuli on a regular basis. So in other words, on a frequent and predictable interval in order for the body to adapt to it. So if you're just having them do a specific type of training maybe once a week, or worse, once every 2 weeks or once every 3 weeks, or maybe they do it a lot for a week and then they stop for 2 or 3 weeks and then they do a lot for another week, it's not regular. There's a lot of irregularity to that, and the body's not going to adapt well to that, which means every time they do that training stimuli, so that workout plan or whatever it is, it's going to be like they're doing it for the first time almost. They're not going to adapt, and so they're not going to need a progression. They're not going to get better because you're not doing it regular enough. So the body only adapts to things that it sees as a common stimulus, that's something it's going to experience again. Okay, if the body doesn't think it's going to experience that again, it's not going to adapt, and it's not going to get better in order to deal with that the next time it happens. All right, the body tries to be efficient. It's not going to grow muscle just to have muscle around, because that requires calories and work in order to maintain that muscle. So again, if you aren't working out regularly, your muscles aren't going to adapt, your bones aren't going to adapt, everything isn't going to adapt. It's going to just stay as is. One of the training principles that are often overlooked is rest. So if you don't allow a person to rest, they're never going to get a proper adaptation to this training stimulus that you're putting on them. So specifically, if you're looking at muscular fitness, you do this workout, you have them lift weights and do all this stuff, and what it's doing is it's causing very small microscopic injuries, essentially, so little tears to the muscle. And the muscle then tries to adapt, it fixes those tears, and it builds it back stronger. However, it's only going to build it back stronger during the rest period, because if you're continually working that muscle, causing those tears, the muscle is just trying to sort of keep up at that point, and it's not given the downtime needed in order to rebuild itself. If it doesn't rebuild itself, it doesn't grow stronger, it doesn't grow bigger, it doesn't grow faster, it doesn't grow however it is you're trying to train it. So the rest period is super important for training adaptations. It's it's also super important for avoiding injury, because if you don't give yourself the rest period you need, eventually the muscle is going to fail and it's going to become injured. All right, the last principle here we're going to talk about is variety. So you need to have enough regularity for the body to see the stimulus, get used to the stimulus, and feel it needs to adapt to it. But you also need to have enough variety where the body doesn't get to a plateau and just kind of stay there. All right, so if you're not constantly changing the stimulus, using different muscle groups, using different angles, using different speeds, and different weight loads, whatever it is, the body's not going to continue to adapt. It's going to get to a point where it's sort of comfortable, it can handle the training stresses, and that's going to be where it stops. So you need to do a variety of things on a regular basis in order to make sure it continues to adapt. So we talked about the FITT-VP principle with aerobic training. There's also a FITT-VP principle when it comes to resistance training, and you'll see that there's one with flexibility training as well, and it stands for the same thing that it stood for before. So frequency, intensity, time, type, and volume and progression. All right, so if you haven't watched it already, go watch the aerobic training video where we talked a lot more about this sort of in detail here and what each one of those mean if you're not familiar with it. The frequency for resistance training should be 2 to 3 days per week with at least 48 hours between sessions using the same major muscle groups. All right, so throughout the week, you want to make sure you work every major muscle group with resistance training. You can do that in full body sessions, so a single session where you work every part of the body, or you can do it with some sort of split routine where you split up the body into segments and you work just one segment one day and just another segment another day. So an example of a split routine would be splitting the upper and the lower body. So maybe the upper body is worked on Monday and Wednesday, the lower body is worked on Tuesday, Thursday. Because you need at least 48 hours between working a muscle group, a split routine is a nice way of being able to do more resistance training during a single week. So you're able to work out on more days per week and put more stress on the body, on a specific muscle group when you put the stress on it. So if you're doing, say, a full body routine, you need at least 48 hours, so basically 2 days between. So you need to do a workout day, you need to have a rest day, and you can do another workout day the next day. So that would be 48 hours. So if you're doing full body routines, that means you can only work out 3 to 4 days per week. If you're doing split routines, if you do, depending on how you do your split, let's say it is the upper body and lower body split, then you can easily just go back and forth. So I can do upper body Monday, lower body Tuesday, upper body Wednesday, lower body Thursday, upper body Friday, lower body Saturday. So I just increase to 6 days a week doing that. Now you don't always want to increase to that level. People are going to burn out. They might get injured just because they're not getting a lot of rest periods or a lot of rest in there. But the point is, a split routine, you can do more days per week with greater strain on the body, which creates a greater training stimulus for somebody who is able to adapt to that stimulus. All right, so either way, no matter what you're doing, full body or split routines though, just make sure that a single muscle group, so if you're doing, again, lower body one day, it means the lower body can't be worked again until 48 hours later. All right, and for new people to training, you might want to give even more than 48 hours. When somebody first starts resistance training, they're going to be very, very sore, and hopefully you're using very low training stimuli for them so that their soreness is minimized, but they're going to be sore just because of the body movements. They're not used to moving through that full range of motion with some sort of resistance, so they're going to be sore. You might need to do 3 days, you might even need to do 4 days for the first week or two between working the same muscle group. All right, so when I say muscle group, the major muscle groups are the chest, shoulders, upper back, lower back, abdomen, hips, and legs. All right, so all these major muscle groups need to be worked at least 2 to 3 times per week in order to get the full health benefits from resistance training. If you start getting more towards fitness or athletic performance, oftentimes people will work them more than 2 to 3 times per week, and to do that, you're pretty much going to have to use a split routine. The I again stood for intensity. So the intensity of the exercise is typically going to be 60 to 80% of 1 repetition maximums, which is why I said it's so important to do 1 rep max testing or 1 rep max estimation testing, because it makes it really easy to prescribe resistance training that way. But anyway, so 60 to 80% is considered moderate to vigorous essentially for resistance training. And this is going to be, again, the recommendations we're giving here are specifically for health. We are not giving recommendations for sports performance or even fitness. It's for health. So in other words, improving bone mass, decreasing cardiovascular risk, those sorts of things, not necessarily getting super strong, getting big muscles, becoming more powerful. Those aren't the things that we're talking about in this video. As I mentioned before, if somebody comes to you who's never done resistance training before, they're going to be sore no matter how much you push them. So you probably don't want to push them a lot. A novice or a sedentary person who hasn't lifted in a very long time, you probably want to use an intensity between 40 and 50% of 1 repetition maximum, just to decrease soreness, to decrease the chance of an injury, and to slowly build them into exercise so they become confident with exercise and they don't quit before you even get them sort of adapting to the exercise routine. The first T in the FITT-VP principle stands for time. In other words, the duration. How long should they be in the gym, lifting weights, doing whatever. With aerobic training, lots of other training modalities, it's very easy to prescribe time. For resistance training, it's not easy to prescribe time, and because of that, there really isn't a standard length of time somebody should do resistance training in order to get health or even fitness benefits out of that. So the first T in the FITT-VP principle is kind of just ignored for resistance training. The second T in the FITT-VP principle stands for type. So the type of resistance training used. People should use a variety of equipment if they have access to it. So free weights, machine weights, medicine balls, bands, whatever. All right, so use a lot of different things. Variety is good. It's going to provide different training stimuli, which keeps the body adapting. It also decreases boredom so that the individual is more likely to stick with it and keep coming back to you, which is good for you because then you keep getting that financial benefit of having a client. So it's good for them because they keep exercising. It's good for you because you keep your client. So when training them or when setting up their training routines, try to focus on multi-joint exercises that incorporate multiple large muscle groups. First, you don't want to use a ton of single joint exercises. They don't work a lot of the body at one time, which means you're going to need way more exercises in order to finish the exercise routine. And it's too much. Most people can't handle it or don't want to handle it. They get tired, they get fatigued, the exercise quality starts to drop, and you're better off just doing fewer exercises that use multiple joints and multiple muscle groups rather than a ton of exercises using single joints and single muscle groups. Always make sure that you work agonist and antagonist muscle groups equally. So if you say do an abdominal crunch, you need to do back extensions in order to sort of equal them out. All right? If you get too much strength on one side, not enough strength on the other, you're going to eventually develop some sort of abnormality, an injury. Something's going to happen that's not going to be a good thing for your client. So always work agonist and antagonist muscles equally. Talking about the volume, so the V in the FITT-VP principle for resistance training for health, typically you want to work each muscle group with 2 to 4 sets for somebody who is adapted to the exercise. If they are a new resistance trainer, so they're novice, they're sedentary to begin with, 1 set is plenty to start with. Start with 1 set. So if you're doing bench press, you do 1 set with a novice, 2 to 4 sets with somebody who's been doing it for a little while. Something I want to point out here that a lot of people who are new to personal training or new exercise scientists oftentimes forget is that it's not just a single exercise that you need to worry about the number of sets for. So I said 2 to 4 sets per muscle group here. So let's say we're talking about the chest. So the bench press, if you do 4 sets of bench press, that's your 4 sets, you're done with the chest. Or you can do 2 sets of the bench press, and let's say you do 2 sets of dips. Dips also use the chest muscles in order to perform the movement. Now that is 4 sets of chest. All right, so you can't do any more chest then for that individual. So you need to total up all the exercises that work a particular muscle, even if it's not the primary muscle, if it's a secondary muscle or a tertiary muscle. For that exercise, it counts towards that muscle's limit on sets. So if you're limiting a specific muscle group to 4 sets, you need to watch how many exercises you choose that are going to overlap with that muscle. Now, when talking about health, 2 to 3 minutes of rest between sets is considered to be reasonable here. So it's going to vary by the individual. Some people might need a little more or a little less time between sets. And if you're trying to train somebody for fitness or for sports performance, a lot of these recommendations here are probably not going to fit that individual. You need to look in a better source for that information than this text in this video here. All right, so on to repetitions. 8 to 12 repetitions per set is typically a good range. It's the muscular hypertrophy range, which is really nice because you're going to get a little bit of strength, a little bit of power. You're also going to get a little bit of muscular endurance because it's right in the middle of all of those. So higher numbers of repetitions is going to improve muscular endurance. Lower numbers of repetitions are going to improve muscular strength and muscular power. So again, 8 to 12 is kind of in the middle, which is kind of like a sweet spot if you are training for health purposes. Remember, we're talking about health here. We're not talking about fitness. We're not talking about sports performance. If we were talking about those things, these recommendations are going to need to be tailored a lot more to the goals of the individual. The P in the FITT-VP principle stands for progression. Remember, we talked about progressive overload. That's essentially what we're talking about here. So increasing the resistance as the person gets adapted to that exercise so that they continue to get better. Okay, the recommendation that you're going to see most commonly in books from the ACSM and even a lot of the books from the NSCA is going to be the 2 for 2 rule. If the person can go through 2 repetitions more than what you prescribed, 2 sessions in a row of the same workout session, that means you need to increase the resistance so that they can no longer do that. And you just keep doing that over and over again until the person is happy with where they are, or until they stop adapting and you have to change out the workout program a little bit. So if you want a little more information on progression for resistance training from the ACSM's perspective, here is the ACSM position stand on progression models for resistance training for healthy adults. So you can go to this link here, or you can scan this QR code, which will take you to that website. Remember, we're just talking about health in this video. We're not talking about sports performance or fitness, which is, I keep emphasizing that because it changes a lot of these recommendations here. But for somebody who just cares about health, so decreasing the risk of having bone fractures later in life, osteoporosis later in life, heart disease later in life, those individuals who those are their only goals, they do not need to progress beyond a certain point with their training. So once they sort of meet the bare minimum requirements for health, you don't need to continue to progress them. They can go into a maintenance program where they just continue to do whatever it is they've been doing, or even decrease their resistance training down to 1 day per week in order to maintain at that level and not completely lose muscular fitness. Let's talk for a moment about exercise order. So in other words, you have a bunch of exercises listed that you're going to do with your client in a single workout. Which ones comes first? Which one comes second? Which one comes last? All right, so large muscles are always going to be trained before small muscles. All right, so if you're doing leg press and you're doing maybe hamstring curls, the leg press uses more muscles, bigger muscles than the hamstring curls, so the leg press should come first. Also, multi-joint exercises should always come before single joint exercises. So if you're doing the bicep curl as well as the lat pull down uses 2 joints, bicep curl uses 1 joint, so the lat pull down comes first. More challenging exercises should always be done before less challenging exercises to minimize the fatigue during those. So let's say you're doing maybe squats with the individual and abdominal crunches as well. Most people are going to find squats to be much more challenging than an abdominal crunch, so the squat should come first. And the last one here is power exercises, if you're using them at all, power exercises should be at the beginning of the workout. So if you're doing plyometrics, if you're doing Olympic lifts, if you're doing any kind of power exercise, that should come at the beginning of the workout before fatigue sets in, because once fatigue starts to set in, you're not going to be able to move the weight quick enough for it to be a true power exercise, and so it defeats the purpose of the power exercise. Power exercises, though, are not a requirement for health-related fitness, so keep in mind most clients of yours who are only worried about health are not going to need power exercises. A little caveat here, a lot of people who focus on muscular fitness in their profession, so they're experts on muscular fitness, are going to probably tell you that muscular power is important for health, and it kind of makes sense if you start thinking about people who are getting elderly and preventing falls and things like that. You want to be able to move your leg under yourself quickly before you fall. Otherwise, if you do fall, you're going to get hurt, and that has all kinds of negative consequences to it. So muscular power can be helpful for some people to improve their health as well, mainly to decrease the chances of some sort of injury or fall or something like that. But again, for the ACSM standards, muscular power is not really important for health based on ACSM recommendations. So I mentioned briefly earlier full body versus split body routines. So which one should you choose for your clients? Generally speaking, full body routines are probably best for novice resistance training individuals. So if they've never done it before, full body routines kind of gets them in and out in one session. They're probably not doing a lot of reps, or probably not doing a lot of sets anyways, so it's still going to be time efficient. A split routine is probably better for individuals who are doing a lot of work in a single muscle group, so they've gotten beyond the sort of novice and even beginner status. They're into an intermediate to advanced status with their resistance training. A split routine is probably better for them just because it allows them to focus on a muscle group today and another muscle group tomorrow or the next day. So again, the experience of the individual is important for determining if they should do a full body or a split routine, and ultimately it's going to come down to the training goals and the preferences of your client. If they want a full body routine, they should do a full body routine. If they want a split routine, if they are advanced enough to do so, then they should have a split routine. So if you open up your ACSM guidelines textbook, and again, if you want to know what book I'm talking about, you can scan this QR code here and go to table 6.6. You're going to see the full FITT-VP principle for resistance training exercise for health standards on that page or in that table, and so it just puts all these recommendations kind of in one place. So it's a good place to reference whenever you're trying to do resistance training exercise. So let's go ahead and switch to flexibility now. So flexibility is basically the range of motion around a specific joint. So your flexibility of your hamstrings are probably going to be different than the flexibility of maybe your shoulder. All right, so your flexibility is going to be joint and muscle specific. All right, so the importance of flexibility is, if you remember, the body is sort of a single kinetic chain. So if you have a lot of tightness in one area, so it's going to likely affect the ability of another area to function properly. So if your hamstrings are super tight, that is connected to the muscles through a kinetic chain to your lower back, and that can cause low back problems. And so sometimes the victim, in other words, the muscle that gets injured, or the tendon or the ligament or the joint that gets injured, is not the culprit. It's not the one that's too tight. It's, again, the hamstrings are tight, which causes low back injury. So you want to make sure that the entire body has an adequate range of motion, so adequate flexibility. Otherwise, the chances of an injury are higher. With that said, if somebody has an adequate range of motion, they're unlikely to get injured, and so increasing flexibility may or may not be required for your client. But I'll say most sedentary people probably could use an increase in flexibility. So flexibility training is very good for increasing range of motion around the joint, as long as that joint's being stretched. But keep in mind that there is a small downside to this. So acutely after doing some sort of static or PNF, so proprioceptive facilitation stretching, so after static or PNF stretching, you're going to have a decrease in muscular strength and muscular power. So it's probably best to put the stretches at the end of the workout rather than at the beginning in the warm-up, just because you're going to get a little bit better of a workout doing that. So just like any resistance training exercise could be turned into a test of muscular strength or muscular endurance, pretty much any stretch can be turned into a test of muscular or joint flexibility. If you get a goniometer, you can measure joint angles that way. It's basically kind of like a protractor, and so it makes it really easy to measure joint flexibility of almost any joint. But some very common tests here for flexibility that are done all the time in fitness centers, as well as like in phys ed classes and things like that, are the sit and reach test here, which you can scan this QR code or go to this link to learn about how to do that, and the back scratch test, which is a shoulder flexibility test, which you can, again, scan the QR code or go to this link to learn how to do that as well. So this is a shoulder flexibility test. The sit and reach test oftentimes is thought of as a hamstring or a hip stretch, but it also has some lower back involved, and so it's got sort of a lot of muscle groups and joints that are sort of involved in the sit and reach test. So there is a FITT-VP principle for every component of fitness, essentially, so that includes flexibility here. So the frequency of flexibility should be at least 2 to 3 days per week for health standards, but if you're capable of doing it, or if you need to increase your flexibility by a lot, stretching the individual every single day is going to give the best results. All the major muscle groups, which are listed here, so the shoulder, the chest, the trunk, the lower back, the hips, posterior, anterior legs, and ankles, all those should be stretched on a regular basis and throughout a single session of flexibility training. And make sure that anytime you're doing flexibility training, so you're doing stretches, that you warm up the muscles involved before you stretch them. Anytime you stretch a cold muscle, the risk of an injury is very high, and also it's just going to decrease the effectiveness of the stretch because you're not going to be quite as flexible, so you can't go to quite as great a range of motion if the muscle is cold. The intensity that should be used is pretty subjective here. It is to the point of tightness and slight discomfort, but not to the point of pain. So it's not an exercise that you want to push yourself through extreme pain for. You're going to end up injured if you do that. So the time of the stretch should be between 10 and 30 seconds. Longer than 30 seconds hasn't been shown to be more effective for sort of young, normal, healthy individuals for increasing flexibility. So once you get to 30 seconds, you've kind of maxed out what you're going to get out of that repetition. I will say, though, with older individuals, there has been some benefit seen to longer periods of stretch, so longer repetitions, so beyond 30 seconds per repetition. The second T is for type again, so the type of stretches that should be done. Dynamic stretches should be done during the warm-up, so it is sort of a slow, controlled movement through the full range of motion, and this is something that's going to help improve both the warm-up itself and your flexibility. So it's going to increase blood flow, increase the heat of the muscle, which is what you want to do with the warm-up, and it's also going to do a little bit to increase flexibility too. The good thing about a dynamic stretch is it's not going to engage the muscle spindles or the Golgi tendon organs, and so it's not going to affect the performance of the main part of the workout the way static stretching might. A static stretch is sort of the traditional stretch that everybody thinks of when they think of stretching. So you go to the end of your range of motion and you just stop and you hold there for a period of time. All right, so there is both active static stretching and passive static stretching. Most of the time when people are thinking of stretching, they're thinking of the passive form of stretching. Active stretching is something that's more common in things like yoga, where you're kind of contracting your muscles in order to hold yourself in a position, where passive stretching would be more like sitting on the ground and reaching reaching towards your toes. You're not really contracting anything to do that. You're just kind of laying there. So your muscles are primarily relaxed. Another form of stretching that can be used, now both of these, the static and this one that I'm about to talk about, the proprioceptive neuromuscular facilitation, or PNF stretching, both static and PNF stretching should be done during the cool down, not during the warm up. And I'll talk about that in just a moment. But PNF stretching is when you combine a static stretch with a contraction and then another static stretch. All right, so because you have that contraction in between, you're going to activate something called the Golgi tendon organ, which is a proprioceptor in the tendon of the muscle. So if you look at this diagram here, we have the muscle that's going to be stretched. We have the tendon here, and you zoom in on the tendon, you can see here there's a sensory neuron that is the Golgi tendon organ. So the Golgi tendon organ is intertwined inside of those fibers of the tendon. So when the tendon stretches, the Golgi tendon organ also is going to stretch, and that causes it to fire. It sends its signal up to the spinal cord, where it's going to interact with other signals that are going to the muscle, and it's going to inhibit contraction of the muscle. So when the Golgi tendon organ is activated through stretch, it's going to cause a signal to come up. It's going to inhibit the signal causing that muscle to contract, and it's going to cause that muscle to relax, causing it to lengthen. So this is the idea behind PNF stretching here. So PNF stretching, you stretch the muscle and then you cause a contraction of the muscle, whether it's isometric or dynamic, and that contraction is going to be what is actually going to activate this Golgi tendon organ, because it activates to a force stimulus. So when there's force applied, it activates, causing the muscle to relax and produce less force, which is the reason why you're going to do a stretch, you're going to do a contraction, and then you're going to do a second stretch. And during that second stretch, you're probably going to be able to go further than what you were able to go in the first stretch. I'm going to put a link to a video talking more about PNF stretching in the cards section of this, so go ahead and go to that if you're unfamiliar with PNF stretching, because I'm just very briefly going over it here. And you'll see an example of a PNF stretch. Most PNF stretching is a partner stretch, which is what you're going to see in that video. You're going to see a hamstring partner stretch that is a PNF stretch. All right, so ballistic stretches should never be done. Can you do it without getting hurt? Of course. People have done it for decades, and not all of them get hurt. However, it has a very high injury risk compared to the other forms of stretching. And the other forms of stretching do as good, if not a better job. So why do this higher injury risk type of stretching? All right, so that's the reason why we don't recommend ballistic stretching anymore. So ballistic stretching is when there's a fast bouncing movement to the stretch. So it's when you see people and they kind of reach towards their toes and they just bounce up and down, trying to reach further and further with each bounce. That's a ballistic stretch. Anytime there's a sort of bouncing, quick, jerky movement to it, that is a ballistic stretch. And again, we do not recommend these at any time. Problem with ballistic stretching is it's going to activate another proprioceptor called the muscle spindle. So let's talk quickly about that. Inside the muscle that's being stretched, you have these intrafusal muscle fibers, which basically is just a muscle fiber in kind of like a capsule, and inside that capsule, wrapped around that muscle fiber, is the actual muscle spindle sensory neuron. So the muscle spindle, this green here, is going to sense stretch. All right, so if you do two types of stretch, so either quick stretch or extreme stretch, which typically ballistic stretching is both of those, it's going to activate the muscle spindle. So it's going to stretch the muscle spindle, causing it to activate. It sends its signal up to the spinal cord. It's going to interact with the other muscle, the muscle afferents, so the neurons that are going to the muscle, causing it to contract. And it's actually going to increase the force of contraction. So if you activate the muscle spindle, it causes the muscle to contract. If you have ever been to a doctor, or even, I'm sure you've seen shows that are depicting doctors, and they do that little thing where they hit the tendon just below the kneecap with a little hammer, and the person's leg kicks out. That's them activating the muscle spindle. All right, so that you stretch it, it causes the muscle to contract immediately afterwards, and that's what causes the kick. All right, so same thing's going to happen when doing something like a ballistic stretch. If you quickly do like a quick jerky stretch, which is what ballistic stretching is, you're going to activate the muscle spindle, and you're going to cause the muscle to contract through this reflex arc. All right, so when the muscle is contracting, when you're trying to stretch it, that's putting a lot of force. All right, so you're trying to lengthen the muscle while at the same time it's trying to contract in on itself. That's what's going to cause a lot of the increased injury risk. The other part that's going to increase the injury risk is usually with a ballistic stretch. You're going to the end of your range of motion and you're just hitting it repeatedly with a lot of force. So even just that force itself, even if you weren't activating the muscle spindle, which you are, you're still going to be constantly putting a lot of strain on that muscle, increasing the chance of injuring that muscle. Okay, on to the the volume portion of the FITT-VP principle. So this is going to be you kind of totaling up the sets and repetitions of a particular stretch and how much total time you want to do a single stretch for. So again, let's say you're doing like a hamstring stretch. What you really want to do is you want to total up at least 60 seconds of stretching that hamstring. All right, if you get at least 60 seconds in, you're going to typically have an improvement in flexibility over time with consistent flexibility training. Again, the volume is 60 seconds per muscle group that's being stretched. So that means if you're doing two stretches for that muscle group, you need to do two 30-second stretches in order to get to the full 60 seconds. If you're doing 3 repetitions, you need to do 20 seconds per repetition in order to get to the 60 seconds, and you can see that so on and so on. All right, so again, you want to do somewhere between 10 and 30 seconds per repetition. So if you're doing the low end of the extreme for the length per repetition, that's 10 seconds. That means you need to do 6 stretches of that muscle in order to get to the full 60 seconds you need for the volume portion of this. All right, so keep in mind that most flexibility routines can be done in 10 minutes or less if it's an efficient routine where they're going from one stretch to the next, maybe even going back and forth between stretches without having an actual rest period. The muscle that's being stretched is rested, but you're using 2 different muscles back and forth, so you're making it a more efficient routine that way. All right, so again, you should be able to get your full routine in under 10 minutes. Flexibility is very hard to define for things like intensity. Again, it's more of a subjective thing, so progression is also very hard to define. You can increase the frequency, so the number of days. So go to table 6.7 in the ACSM guidelines textbook. So again, you can scan this QR code here if you want to see which textbook I'm talking about, and it's going to put all the FITT-VP principle for flexibility exercise together in one place. It's just a really good reference for you. We're not going to go over it because we went over it in detail already. So one other type of exercise I want to kind of throw into this video here, so it's not really flexibility, it's not really strength training, but it kind of relates to them in a lot of ways, is neuromotor exercise. So this is a new type of exercise that's now being recommended by the ACSM that people should be doing, especially older adults. So neuromotor exercise involves motor skills like balance, coordination, gait, agility, anything that's going to be required for you to sort of get around in space and kind of know where your body is and just have a sort of control over your body. So think of things like yoga, think of the martial arts, think of like a gymnast. They're very good at knowing where their body is and sort of contorting their body sort of at will, and that's because they've trained their body to have a very good sense of kinesthesia, which is sort of where your body is in space, and also they've trained their neuromotor system so that they can contract muscles exactly as they want. They can stimulate the muscles as needed in a very coordinated fashion. This is really, really good for older adults to prevent things like falling or different injuries that are sort of from, like a clumsiness or a lack of coordination, because again, neuromotor exercise is really good at improving your coordination. Because neuromotor exercise is sort of this new area that people don't know a ton about yet, still being studied, the optimal dosage and effectiveness of it hasn't really been panned out yet in the research, but generally speaking, greater than 2 to 3 days per week, greater than 20 to 30 minutes per session, in a 60 minutes total or more per week. So that's kind of the volume. That's basically the recommendation. So if you want a little bit more detail on neuromotor fitness and the FITT-VP recommendations for that, look at table 6.8 in the ACSM guidelines books. Again, you can scan this QR code here to see which book I'm talking about, and it's going to go through the full FITT-VP principle and tell you exactly each letter what is recommended by the ACSM, and you'll get a better understanding of neuromotor exercise and neuromotor fitness. And what's recommended for you as well as your clients to be doing. So again, this was not a full extensive overview of muscular fitness. It's just not the purpose of this class. We're talking more about health, and for health standpoints, the sort of bottom threshold for muscular fitness is fairly low. If you're looking for fitness or sports performance, this is definitely not the proper recommendations for you. But I hope this was helpful. If you have any questions or comments, you can put those in the comment section below and I'll try to get back to you. Otherwise, please come back and watch another video. Thanks.